So another disorder that is very common is gout. Gout is certainly a metabolic disorder, and it's a uric acid production or exertion disorder, impairment of production or exertion. You can find high levels of uric acid in the blood, or if you can test other body fluids, it will be present there. Concentration of uric acid in gout is very high, and what happens, it is high enough that can crystallize, and crystallization will result in deposits in connective tissues, and in connective tissues it's okay, but when we're talking about connective tissues such as joints and synovial fluids, this will lead to inflammation such as gouty arthritis, or colloquially gout. Again, without going into too much details, gout is related to purine metabolism, and by purine we mean adenine and guanine metabolism, and people may have very rapid purine metabolism and breakdown, and which means patient will synthesize too much purines and it will start breaking down. On the other hand, this also may be caused by poor uric acid exertion by the kidneys. So again, at some point the concentration of uric acid will increase so much, so it's time for crystals to deposit. So the crystals will deposit in lower extremities, and which will cause gouty arthritis, and the crystals usually deposit in metatarsophalangeal joint, so basically in big toe. One of the points here that uric acid crystals are very well formed, and we know if crystal is formed, the edges of the crystals are very sharp and they have ability to irritate and damage the joint, and this will cause inflammatory response. You may notice in observation of metatarsophalangeal joint that actually there is erythema, edema, and of course tenderness to touch. Patient will also have symptoms of deposits of uric acid crystals in other places with connective tissues, and especially very well-known phenomenon is deposits of crystals in the cartilage of the ears, or so-called Toffees. When we're talking about clinical stages of gout, again, to recapture what will happen, the symptoms of gout don't happen overnight, and patient will be in a relatively long period of asymptomatic hyperuricemia, and when the concentration is significant for crystal deposits, the crystal deposits will start depositing in the joint, and at that time also inflammatory response will occur. So Toffee can again deposit in any type of connective tissue such as ear cartilage or in metatarsophalangeal joint. So this is schematically represents what happened with with uric acid crystals and there is attempt for phagocytosis by a leukocyte, and eventually the crystal will be exerted from phagolysosome, and the leukocyte will be disturbed as well. But after that, the resulting crystal will cause inflammation. Fibromyalgia is interesting disorder, and it is one of the overly misdiagnosed or overdiagnosed disorders. A patient will present with vague symptoms, and the symptoms include sensitivity to touch. There is no inflammation per se detectable by laboratory method or observable. Patient will have fatigue, sleep disturbances, and it's truly, there are no objective factors that may confirm the presence of the disease. But fibromyalgia, it's chronic, widespread joint and muscle pain. But again, as we've been told over and over, pain is what the patient report, and that's not that you think. But with fibromyalgia, there is no objective data that confirms the presence of the disease. And there are been discussed in the literature several possible factors, such as viral illness. Also, chronic fatigue syndrome can be misdiagnosed as fibromyalgia. Another possible misdiagnosis can happen, and it's all more serious consequences. When flu-like viral illness or chronic fatigue disease, of course, they are very taxing, but patient has chances for recovery without interventions or with certain interventions that will work. But in case of HIV infection or Lyme disease, there were cases that patient misdiagnosed with fibromyalgia, which delayed the actual treatment. Some medications like beta blockers may cause or the symptoms of fatigue, or other medications like statins may cause muscular tenderness or myalgias. Also, physical and emotional trauma certainly may result in aches and pains. But overall, there are no scientific studies that will clearly define the cause or etiology of fibromyalgia. Fibromyalgia diagnosis, if diagnosed correctly, should be diagnosed based on this diagram. Patient has to express pain in these pressure points. So pain should be symmetrical, and pain should be present in most of these pressure points. But in reality, when you find diagnosis of fibromyalgia in chart review, again, there is no evidence even this examination has been carried out, but basically based on the history and patient presentation, without carrying out the pressure point examination, which is presented here, the patient may be diagnosed with fibromyalgia, which is certainly inappropriate. Again, this is a disease of based on history and diagnosis of the exclusion. If patient comes to you with unknown fatigue and unknown pains and aches, try to see bigger picture and try to proceed with more diagnostic studies and more background than just proceeding with diagnosis of fibromyalgia just because patient fits that type.